We go join Studio 2 and bring you the program Well Body Talk.
Early detection of earlier prevention, and but this is the second time we can Well Body Talk. Perhaps we guests or we listeners or viewers then not to the same for today. You can take me through a little background about yourself, Dr. Lanes N.S. Kamara.
Okay. So me na pikin doctor, called pediatrician. I also specialize in dealing with pikin with blood and blood disorders as well as cancer. Okay, so the right title is pediatric oncologist. I dey work now all I do in Children's Hospital where people like call cottage, the pikin side, because the under we get cancer what day, also they admit pikin with cancer and treat pikin with cancer. And very soon the new hospital in Alumni, the new Children's Hospital in Alumni also get a newly built cancer ward for pikin.
Okay.
Well, very soon, within this first half of the year, instead will come into full operation. So I'll be running both units because the numbers they don't increase, so we need more space.
When you talk about, you say the true name now, oncology or oncology, what's in that meaning?
So oncologist does mean somebody where they treat people with cancer.
Okay, but so you specialize in the area of the picking them?
Yeah, picking them, yes, picking cancer.
What do it take for make you be experts for treat cancer, especially in picking them?
Well, you get to go through a training, they call a fellowship program. So, me actually developed this passion for picking with cancer when I've been working all I'm doing. So, and some sort of services that we did, some low-grade services that we did for them picking and day, but they find out, say, a lot of them were not doing so well. And there was a gap in terms of knowledge. So when opportunity came for the fellowship in childhood cancer in Ghana, so I go for the fellowship. So it's a 3-year program. You get for, it's vigorous. At the end, you have to write a dissertation and take an exam. Then go make you a pediatric oncologist.
So that means you no go able do course na commerce when at the College of Medicine and Allied Health Sciences, and you be expert from that point there.
Oh, I'm an alumni of commerce. So how?
No, I mean, is that your education at commerce not going to be enough for you for able to be like your first degree? So be expert in that area?
No, so with medicine, with clinicals, there's a pathway for we all, globally, internationally. So commerce, na first degree, MBCHB. Okay? After commerce, you want to go to you call membership. Okay? Then they say, now 2 years, so people they do 3 years. We do membership, they become a specialist pediatrician or adult physician, whatever, so you do, or gynecologist. Now we want to do something now beyond that. It's called a fellowship. So where either you want to go sub-specialize or even in the general pediatrics, you can do a fellowship in it. So that's the pathway. So you need to come up from commerce to fellowship. You get for do membership. No matter what part of the world you do, that's standard practice. So that's all.
A lot of departments them or expertise in the medical field. Why Dr. Lennis choose picking cancer, especially for treat cancer and picking them?
Okay, generally, I love for work with picking them. I think I find it easier because with picking them, it is what you see. They're not get a long story where they will tell you 10 years ago, let me shoot me with which gun and all that. With picking them, it's quite direct. It is what you see. When they are sick, they are very sick. When they are well, they don't even need to tell you, I want discharge. You see them. So I love working with kids in general. In terms of cancer and picking them, so when we finished my membership in 2016, I return back salon. I may find some sort of service we go on, some basic service for provide care for people with cancer. And I may see how the struggles were there because the expertise wasn't there so much. Logistics was a problem. Unaffordability of the parents then for the treatment. So we are losing the children, and that was quite heartbreaking. So even as a specialist, I begin for working at the ward, at the unit. Try to see how we're able for just, save the few that you can save. Until in 2019, through World Child Cancer, this opportunity come for do a fellowship for somebody who don't do membership or interested. So of course I went for it, do my fellowship training and finish successfully. So it's basically, trying to save the few you can save, because if someone is not there, all of them will die. So at least if you're able to save half of them, that's, for me, it's a big win. Okay, and there is no one in Sierra Leone for now except me. Thankfully, somebody else they're on training. So hopefully, very soon it will be two. We will make the workload a bit lighter.
So for Salone now you are the only experts now for cancer in Peking.
Yes, for now. But somebody else they in
training. How do
you
work down like you won and you station at Freetown in cancer situation at the provinces? How we don't sound like?
So it's a lot, I'm not gonna lie. But I get a strong team around me. So it's not just the doctor, so the team of nurses. Before I go for my fellowship training, when they start this, they do this cancer service now, like doing in cottage, we get some people from South Wales, Cardiff University specifically, where they come out in a salon, but they do one-on-one training with nurses, with myself, and also they try for pay for chemotherapy, because most families are not able to afford. So all the training they do over the years for all these nurses, they're all around me right now. And recently, 2 of our nurses don't go do fellowship training in the nursing care for them people with cancer. They Ghana as they speak. They will finish around September this year. They'll be back for able to teach the others. So I have this strong team of nurses around me. I get pharmacists. So it's a multidisciplinary team. It's not a one-man business.
You say you get passion for work with Peking the treatment because they not get a long history. Say, when I've been there 5 years, when I've been there 20 years, I get this incident, I get this, that. Straight to the point, not Peking, and say perhaps in first case down there. Who say you get that passion? Who say begin develop, and when did you begin develop the passion? Say, me I want work with Peking them.
Well, for me, I actually developed the passion for work with Peking when I started my internship. So when you finish commerce, you do what we call house job, where you rotate at the 4 main disciplines then at Freetown. That is internal medicine, and the big people are on pediatrics, and the Peking surgery and gynae. For rotate they all. So during my rotation, I actually fall in love with pediatrics because I may get good bosses at that time where me, they're willing to teach, and they made it quite interesting. So me actually get the passion for work with beginning when I rotate doing house job.
How the workload done sound like in terms of the number of picking them we they treat per day or per week?
So cancer treatment is long. Cancer treatment also like malaria when 3 days, or typhoid when a week or 2. They talk about months of treatment. So we major challenge all they get is because over 50%, over 70% of our cases are from the provinces. And most of them not get family and Freetown for stay with. So they can come for treatment, they can stay very long in the hospital. I think that's the major challenge, the long hospital stay. So we not can get choice, but forget them breaks in between treatment so when they go home. Because they come when they can gains, they left the other picking them there, they want to see the other picking them and all that. So I think that's the major challenge. In terms of long treatment, it's part to the job. It's what we do. So that's not an issue for treat them long. It's just that when they can stay long in hospital, the parents can become quite anxious. So we can need for they give them breaks. And remember, say when you say they give breaks to somebody for go home, somebody who they beyond corner, get for help with transport because you want me to go come back for continued treatment.
Provision can do for them, or now the doctors and keep them?
No, so we get a major sponsor, World Child Cancer. Now they actually give me the scholarship for go study. So they help a lot with them transportation, for picking in treatment, diagnostics, drugs. Also, Cardiff, South Wales, they also have to help with drugs. So they are major partners who they work with, because trust me, 90%, over 90% of the families that come in with children with cancer cannot afford treatment. So if not for these people, there is no way for me able to treat them here.
Okay, Dr. Leone Senes Kamara, a studio guest for today in a specialist pediatrics department, University of Salon Teaching Hospital Complex, and today we will look at cancer in Pikin. That not just be intro when they do, and for just give highlights of your work and who that's now you. Look into the topic proper.
Okay.
Today we will look at cancer in Pikin. First of all, what's in a cancer?
Okay, so cancer, in the layman's term, now when part of your body, we body make up of different parts that we come together for make we humans. But as I talk specifically for picking them, if for whatever reason, a part of your body starts for the cells them, so we'll say cells, you just say like when you say os. Different, you take blocks them and cement and put them together and form the os. So then blocks them that they will call cells. If for whatever reason, them blocks then they decide to behave in an abnormal fashion, then they begin to grow, then they multiply, and then they destroy the area outside, and they're not going to just tap they go destroy the other structures that will surround them. They also not go tap they go go back, go sit down at other parts of the body way far from the original site. So now they make the basic thing about cancer. So abnormal cells, abnormal growth, they cause destruction, both near and far. Then a cancer.
Pikin when they just born get cancer.
Yes,
now
please.
at which age is they at risk for get cancer?
So cancer in Pikin can actually start from day one of life. It can be noticed.
When they just born?
Yes, it can be noticed.
Is it that?
Some of them can actually be diagnosed when they're in the womb. If you do a perinatal scan.
Yep, go ahead.
Sorry, my voice is a bit hoarse.
Okay,
and they recover from cold.
Okay.
So some of them can be diagnosed in the womb. So in doing a scan, the radiologist can see some abnormal, organ or growth within the baby. So before the baby born safe, the oncologist go down, be aware, say there's a baby what they born with possible. The common one we don't see where then pick her up from what they did in my womb that make cancer of the liver, hepatoblastoma. Yes, so that was picked up.
We can look at different type of cancer.
Oh, them boku, yes. So yes, so from the zero, so for picking the cutoff now 17 years. Okay, so cancer they occur from that age till you old and die. But just that the cancer they affects picking them different from the cancer they affects adults.
How I can detect them from the mama in belly?
Well, it's very few. Scan can see. Scans.
We get the facilities for scan and asalo and see. And
yes, it's a very good radiologist able for pick up if there is something abnormal within the baby in the womb during the last 3 months of pregnancy. Yes, it's able for pick them up when you go for that scans day. But very few really, when you look at the percentage, are very few you're able for see at that level. Most of them, we can see them between the age of 2 and 5 years. Now the most prevalent age way they able for manifest the signs of childhood cancers. Like I said, they're different from adult cancer in big person.
But they can look at cancer in Pikin proper. You say perhaps some kindina de mama de belly una notice them. Is it that Pikin and they born with the cancer, or did they develop the cancer as they grow?
So they can develop them. So what can happen? Like just one thing for be clear is, over 90% of the cases, the causes of cancer in Pikin is not known. Okay? It is not known. So to some to get control over. So imagine you need to know about something for able for prevent, right?
Yeah.
If the cause is not known, then there's very little we can do to prevent it, and that's with childhood cancer. There's very little you can do in terms of lifestyle or anything to prevent it. It's just that when the Pikin and from a Pikin form are too small cells that they come together for become a human being. And that process where they divide for become human being, small mistakes them at the genetic level can happen.
Okay. The program Well Body Talk will come to you from the Society for Radio Democracy 98.1 FM. If you just join we, yourself will get chance for take part now this interesting discussion. The program Well Body Talk, we will bring and come to you. Musa Kamara na my name. And my guest now Dr. Leone N.S. Kamara, specialist pediatrician, pediatrics department, University of Salon Teaching Hospital Complex. So they will talk about cancer in Pikinde and also how for detect them early. Now we look at, you say something can get under the mama in belly. Is it natural on a lifestyle of the mama can cause that?
You know, get nothing to do with the mama lifestyle. Like I just say, if we know what they cause most of the cancer, then pick them for able for prevent them, maybe from conception, but most are not known. And like I be they say, when the pikin they form within the mama belly, because they're too small, cells that they come together, an egg and a sperm for be a whole human being. During that process, the way the cells then they multiply and they divide, small mistake then can they at the genetic level. Then you know enough for me you get cancer. But after the pikin don't born, if you go to what we call a second hit, now this second hit can be anything. One of the known second hits them now exposure to radiation where the pikin they form in the womb. And it can make beloma and they do X-ray, especially that first 3-4 months of life. They can make beloma and do X-ray because radiation are a known risk factor. We will increase the risk for make the baby develop cancer.
Person get belly, let pikin develop cancer.
Radiation exposure.
What's in a radiation exposure?
So radiation, so we do X-ray. You know they see them. So these are like beams, high energy beams, where they use for get a picture of how your chest fiber inside. Okay, the high energy beams then get the power for distort your cells. Okay, if you're exposed to it in very high levels. Also, then normal X-ray, how would you do so? That's not enough. You could do 100 of them, you not get risk of cancer. But that baby, what they form in the womb, is quite sensitive at that point. Then can make no beloma even need agree for me do X-ray. If beloma really need for do any radiation, they go to they call a shield. Then they shield the baby for me go through that just because they are quite sensitive to radiation during that stage the way they develop na the mama in womb.
In a situation picking the 1 month, 2 months, or maybe weeks, then a mama gets a condition where need X-ray, where perhaps instead now we are saying in belly. What would they do in that situation?
So normally for X-rays, what you know the adult physician before they send any woman for X-ray, they can always ask if you get belly or you last menstrual period, because that's very important. That I know is standard practice. But if the woman really need the radiation as a matter of urgency, and the woman get belly, like I'll say, they shield them. Okay? Then get the metal shield then they use so that the radiation will penetrate and will go through X-ray.
Radiation again can be perhaps exposure to maybe then communication pulls them around. Is it? Is it the cause them or metal work and other things then?
So yeah, well, those electromagnetic field, I think that's what's more with the telecommunication. Really, there is no study. We don't directly link them with childhood cancer.
But radiation.
Yes.
Okay.
But electromagnetic rays per se, the one they use for communication, the one they use telephone and those things, there is no study we don't prove say they're linked to childhood cancer. What thing don't show is early exposure to the people they develop now the womb to things like X-rays, okay, or CT scans, where they emit that kind of radiation. Those ones have been shown, but the one for communication, not really. But people are speculating, so it's more of speculation. But medicine is evidence-based. Okay, so what's the evidence don't really show not much for do with communication as a risk factor.
Okay, now look at the type of cancer in Pikinde.
Okay, so different parts of the world then get different cancers that were more prevalent. So there are many type of cancers. I mean, like I say, it can affect any part of the body. So for zooming on Sahel or Sub-Saharan Africa, the common one though they say now the eye. They call it retinoblastoma. And usually, mama then can notice that they in pikin them before they did 2 years. So the 1 year look the shine, like you say pussy eye. The 1 year they shine like pussy eye. Or if then take picture of the pikin and net na the phone, because normally we take picture on net, you for see like red dots them na the eye. Yeah. But then go notice say one side white, one side red. So those are the common things that one can pick up. And it will surprise you for know for say most of the time they can go to doctor. But because the awareness not be there before, they can just say, let's say, oh, na again, and for just go make immature. So anytime, so we don't do a lot of sensitization on early warning signs with healthcare workers in the district. So that anytime mama goes say, this me picking eye shine on her net like pussy eye. Therefore think about cancer of the eye and refer early, because one of the most curable cancers them. We detect them early. Very curable.
At which age then go detect that?
So it starts from the first year of life up to age 5.
The one.
From 9 months, we don't see retinos in a 9-month-old baby. Some from 6 months, because so come on, we tell you say, well, 6 months old and snap them. Now I notice this. But because of the lack of awareness and education, they don't go can't until the eye don't destroy, the eye don't push out. Now you tend to go calm. So usually then are the first early sign. So uncommon, but highly curable. The other common type of cancer what they see, nasalonia, and the one that affect the kidney, we call an nephroblastoma. So if we detect them early, it's curable. The other one we call a lymphoma. So this now, I don't know if I call it. Where people like get cold, they can get swelling then na the neck there. Where the cold can don't go, especially picking them. Where the cold can don't pass away, it they go down. But that one where they left na the neck, a month, a 2, it they increase in size. Okay, it they come back na other parts of the body. And you notice that the pikin they get fever. Over 2 weeks, if they get weight loss, they sweat bokona net. We call them lymphomas, and they self common. Okay, so these are the common types that we will see, but there are other types as well. We get the type the way they affect the bone. That no more they see them in adolescents. They call it osteosarcoma. We get the one where they affect muscles in your body. So any part of the body, from your eyelid to your face to your limbs. We also get the brain cancers. So in this part of the world, brain cancer is not as common like the West. We also get the blood cancers, which quite common globally. They call it leukemia. Okay, so these are some of the cancers they will get in picking them, but there are many. So the liver as well.
Also, very common nasal.
So there are 3 of them. They keep alternating every year. So the lymphomas, that I talk about the lymph node, they are with the common at the neck, at times under the arm as well, at times at the groin part. Then common, the ion and the kidney ion. So what I don't notice, like a couple of years back, we see more of eye tumors, but last year we see more of lymphoma. So there are the 3 commons. Each year, one the boku small passing company, one go boku small passing company, but they keep rotating as the common type of cancers that we will see in picking them.
What about the one we picking gum the swell, like the gum the swell and even the blowouts, the show outs, the gum all the show outs.
The jaw, you mean?
The jaw, yes.
Oh,
the gum. Yeah.
So now the lymphoma that one the buckets, and lymphoma that the. So now they say quite common bucket lymphoma.
Okay, continue for stay with me inside the program Well Body Talk. We'll come back. We'll go for a short break. We'll come back. We'll look at treatments, causes of cancer, and also we look at the February 14 we na International Child
15.
15 February 15 we na the International Child Cancer Awareness Day. Which una they do na the sector for raise awareness about cancer in picking them. The program you listen to na Well Body Talk we come to from 98.1 FM. Me they bring you this edition. Musa Kamara na my name today. We talk to Dr. Lanes Enes Kamara, in a specialist pediatricians department, University of Salon Teaching Hospital Complex. And we dey look at cancer per pikin dem, early sign, lifestyle wey go lead to cancer, treatments and prevention. We dey go for short break, we will come. We dey continue with the studio guest on treatments and causes.
Lady Courage. No condition.
The condition is permanent. Oh, yeah.
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 Like we are living, my bedroom is full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. 'Cause no condition.
The condition is permanent. Oh, yeah.
'Cause no condition.
The condition is permanent. Oh, yeah.
'Cause no condition.
The condition is permanent. Oh, yeah.
'Cause no condition.
The condition is permanent. Oh, yeah.
This is Chibang's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah. No condition is permanent. You never know if someday you will find yourself in that same situation. In this life, you've seen today, tomorrow is not promised. In a twinkle of an eye, your story might change. Be you black or white, no matter your personality. Be you rich or poor, your story might change. 'Cause no condition.
The condition is permanent. Oh, yeah.
'Cause no condition.
The condition is permanent. Oh, yeah.
'Cause no condition.
The condition is permanent. Oh, yeah.
'Cause no condition.
The condition is permanent. Oh, yeah.
Shout out to you, white priest. YUK man of the moment. I salute you.
The program is still listening to our Well Body Talk. We come to you from 98.1 FM. In case you just join we, you listen to Dr. Lanes N.S. Kamara, specialist pediatrician, pediatrics department, University of Salon Teacher Hospital Complex. Now we studio guest for today's edition of the program Well Body Talk. May they bring you this edition, Musa Kamana Minim. We look at cancer in picking them. You don't talk about the different type of cancer and how they detect them in picking them as early as possible, and some even inside belly. Now look at what they cause cancer by picking them.
Okay, so the cause over 90% of the time causes unknown. But however, we get a few what we call risk factors, things that would increase your risk for get cancer in picking them. So in a very few, less than 10%, it can be hereditary. It they run in families. Like that eye cancer, so it can be hereditary as well as non-hereditary, as well as kidney cancers. Themselves can be hereditary or non-hereditary, but the heredity is less than 10%, really. Another thing we can increase the risk for make you get cancer and radiation exposure, as we don't spend so much time on them before. Another thing again, we can increase the risk for get cancer and certain infections with certain viruses, HIV, another virus we call Epstein-Barr virus, hepatitis B and C, we get them chronically. then they all can increase the risk of cancer. And then also certain drugs, them exposure to certain medications can also, increase the risk of cancer. But over 90% of the time, the cause is unknown.
The cause is unknown. And earlier, you don't talk about the sign of cancer and picking them, like the one way they did at the neck and the one at the eye. And you talk about the kidney. How parents then go able to detect cancer in picking, especially when we get with the kidney.
Okay. Well, I just always use the opportunity for talk about early warning signs in childhood cancer, because that's the teaching way we don't try for cascade nationally with healthcare workers on early warning signs. We also don't engage a lot of comrades, in the marketplaces, in different places with flyers on early warning signs. So the common one, okay, say na this white dot na pikin eye, we see are not just fit to say na jege you for come hospital. If you notice any or change in the way they waka, they waka normal, now they waka like that check. Think about cancer as well. So you should think about it, because sometimes it can present like normal malaria, a normal infection. So if you don't think about it, you might come in too late. And cancers are in picking them, as long as you come in early, most of them curable when you come in early. It's different from big pussy on them. But when they come in late, it is a problem. So that is why we don't spend a lot of time on awareness raising, education on early warning signs, because even the health workers them know me to understand about cancer. So at times the parents they go with the picking and but then they point them in the right direction because they are not thinking about it. But now they are. Now we don't get so much referrals. People are now thinking about cancer. They see swelling. Let me go check this swelling, but you can send a more check out, say, okay, no, this is not ordinary swelling, not to cancer. Then you assume there, it's not ordinary swelling, then by the time you catch up, the thing go don't spread.
If they detect cancer in Peking, come not for worry at all?
Cancer is sick, not to malaria. So definitely, big pussy combo, when you get a diagnosis of cancer, you should be worried. And that means you for seek treatment early, because when the disease they low stage, where they one side, no move, don't destroy surrounding tissues, or you don't move to other side, the chances of cure are quite high. But wait till they suffer with Nasalona late presentation. They count to be very late, when it can don't spread all over the body, and there's very little you can do for cure them, even in the best centers in the world. So that is the major problem. We'll make they raise this awareness. That's cancer to which man because that it is there. It don't do from time immemorial. It's just that the awareness not me day. This are the picking the way they can say now which man don't in blood. Then get and blood say he die, or in belly swell he eat which beef, they go left and a forest na na the village them. So they've always been there, but the awareness not me day. So now this awareness one try for raise, so that we go get them for coming early. Because the earlier they come in, the better their chances of survival.
The program now, Well Body Talk, will come to you from the Society for Radio Democracy, 98.1 FM. When we come back to you, we take a look at treatments, the medicines the moon the use, and you earlier say most of the people they can get cancer, then people don't need to afford the treatments in some situation. You self when they listen, you get any question for we experts today na the program, you can call now on 077 981 981. You get concern about cancer in your Peking or your neighbor in Peking, or you want general knowledge, you can call on the number 077 981 981, and the number for call and drop you or you send message on the same number, or you call 077981981. The number, the phone line now open, and in case you just join with studio guest today, now Dr. Lennis from the Dr. Lennis in our specialist pediatrics department, University of Salon Teaching Hospital Complex. 077981981, the number for call and make a contribution inside the program Well Body Talk. Now we look at treatments. What are the treatments them we available for cancer in Peking?
Okay, so most cancers them in Peking, the treatment we call a multidisciplinary. So we dey use medication them. We'll call chemotherapy. So this can be in the form of tablets. It can be in the form of injectables, mostly. We also surgery, very key and important in the treatment of them Peking. So most of them we can use both the medications as well as
we get a caller on the line. Okay, yes. We don't lost that caller there on 0779819181. Continue for call and make your contribution inside the program Well Body Talk. Yes.
Okay.
Go ahead.
Okay. So surgery very important on our operation. Because sometimes we can need for shrink the cancer.
We get a caller on the line. You name it, we said a call from Well Body Talk. Hello?
I call from Calvato.
Yes, your contribution.
Really, this one is going to talk on this video. A good idea because the lighting we even are the parents. But where's not the problem? We go now hospital, then government hospital. Like you don't know seriously I live at this post here, but when I send the medicine for the 3D post, nurses there working, they close to the beginning. And then are the problem. They're not carrying. And you take the medicine and they sell them. Even if they go there, they will tell you say that's also sick but we don't prescribe the medicine. They know they treat the picking there, and that's not the main concern.
Thank you very much for your concern. Thank you very much for your contribution inside the program. Okay, then welcome. 077-981-981 a number for call and make your contribution inside the program. The program now Well Body Talk will come to you from the Society for Radio Democracy 98.1 FM. 077-981-981. Call and make your contribution. Yes, go ahead. Even they say something.
Yes. Can I answer that one?
Oh, yes, you go yes, pen and down, then you answer them later. You be the talk on
the talk on
something, yes, on treatment.
Okay. So we say operation. So most time we can don't give the medicine can shrink the disease and get around one side. But they make it easy enough for the operation doctor where you go in for able to pull everything out. Okay, so it can go hand in hand. At times, we can need a third modality of treatment, what they call radiotherapy. We unfortunately not available in Sierra Leone, which is a big hindrance. Sometimes, for me, you cure PK with certain type of cancer, you need all three modes of treatment together. So if you begin radiotherapy, pass you go for look for sponsor or donor, for help them, for go out of salon, for get that aspect of the treatment. But the surgeries, most of the surgeries are done here, except few specialty areas that like people are where they deal with things that for do the liver.
Okay, we'll get a call on the line. We go answer on the treatment more. Hello, your name was call from Well Body Talk.
I'm calling from Mamba Ridge.
From Mamba Ridge. Your contribution?
I just want to know how it connects between the cell membrane and the blood vessels. How it connects to help for protect cancer.
Come again?
Cell membrane.
Yes.
And blood vessels.
Okay, cell membrane and blood pressure.
Blood vessels.
Blood vessels. Okay, blood vessels. Okay, no problem.
The cell membrane and blood vessels, how they contribute to what?
Cancer. Okay.
Okay.
Okay. 77981-981 a number for call and make a contribution inside the program. We go on the treatment again. Go to put the questions then they down and you go answer to them before the program round up. 77981-981 a number for call and make a contribution. Yes.
Okay. So basically those are the modes of treatment really available for people with cancer.
Apart
we
from
get two of them in salon, we'll not get the third one.
So what you can do in that situation?
Like I say, we go for fan donors because it's not cheap. For fly them go.
Now the machine not available or not the expertise?
Available. The machine not available. We don't get medical oncologists. We don't train in radiation oncology. They are in Sierra Leone. They are in Connaught Hospital, but the machine is not available.
How much the machine go cost like?
Oh, it's expensive and it's a national thing, but I know that the Ministry of Health has been in talks with the IAE, the International Atomic Energy, because it's a whole process. Also, like for just bring X machine can put them. You can forget designated area, you can forget a bunker, you can for bill for them because you talk about radiation. You can forget how to dispose of your waste. There are international standards that has to be followed for you for get a radiotherapy center. I know the Ministry of Health has started talks on that, so it's something that the ministry is working on. But currently, it's yet to be available. So for now, pass with the, talk to goodwill people and for help them for pay and just go do that aspect of the treatment and then come back, we do the rest.
What are the rates of them picking them wellness we can get cancer? We'll get a caller on the line again. We'll get Osfred on the line. Hello. Welcome to the program Well Body Talk.
Mr. Musa Kamara, thanks to Mrs. Kamara, doctor.
Yeah.
I know they do a lot of job, they are doing a great job. I don't know if actually partners in health, they actually give them help in terms of this infrastructure. Because this is the biggest challenge you get in another area of diagnosis and the use of radiotherapy. But I don't know if partners in health, together with UNICEF, if they don't ever try to write a project, would it directly go into those challenges? And then I don't know again if they use this method. I'm not saying a pediatrician, not only in terms of oncology, that area of the cells, but the point of area of how they can help for diagnose. But picking on the talk. But I remember in those days, and they use the fingers for palpates, like under your ribs, for check for the liver and the spleen inside. If that's then they help for show to the primary health care nurses them, usually within directly contact to the patient and the mommy, so that then we will count them to secondary and later refer them to tertiary sports. But in areas of how they will able to do their resourcefulness with diagnosing this way, the spleen and the liver, where they use your hand and test the size of the spleen. I don't know if they use them. But I hope see them go able to see how governments go able to direct some funds towards this. Because that area, they plan, then they get radiotherapy, but we know they still see waiting they come up for that, especially for private sector with the drum. So I only hope see them able to help salon. Thank you very much, Mr. Kamara, and thanks a lot to you area for work. Thank you very much. God bless.
Okay, thank you very much. I hope the Minister of Health now a fan of Well Body Talk, and the Minister of Health they follow Well Body Talk. Perhaps support go come on, or you as an NGO or arts organization where they listen, maybe can help in the aspect here. So I'll be asking you before this Osfred call, say, what are the rates of recovery in picking the owner can discover cancer?
For now, with major challenges, they are not coming early. And they come very late, where it cannot spread. So we're not able to cure the underlying disease. So when person come with cancer, maybe I'll just go talk about how they diagnose. So we do a lot in the diagnosis more than waiting people say. So maybe I'll go into that a bit.
Yeah, we come.
Okay.
Before you come answer the questions, then they talk about the recovery rates in picking them, and you say if they come with the early,
yes,
they go able well.
Yeah.
Now, how long cancer go they in posting we could be, or in picking we could be a risk of not recovery again?
So it depends. So cancer, there's a lot of genetics involved in it. So depending on what is driving that cancer in that child, some cancer that at a very early stage they don't move. Some of them can stay one place for a while, where you not do anything. Then they move, go sit down somewhere else. And most of them, they can begin notice them early. Truth be said, the combine they can begin notice early. Now, seeking the right care, that is the problem. So it's multifaceted. You notice say the pikin belly the big. You don't get one medicine, you don't get a country medicine, it no work. You go to a health center, the healthcare worker say no but cancer. Instead of go give you medication them. You go 1, 2, 3, it no work. Then they sign up for saying you go to the district hospital. probably you don't spend 6 months or 8 months still battling with this one thing. Maybe now from the district hospital now, they go say, okay, this might be cancer, and then they send to we. So every picky worker with cancer, we do what we call workup. There's a whole lot we do for stage the disease, for know if a low stage or a high stage.
Okay. You get questions there and we callers they don't ask. You can respond to them. We could look at the International Child Cancer Awareness Day.
Okay. So I think I want to start with this diagnosis, the last caller.
Okay.
So in every clinical medicine, everywhere in the world, even in the US or the UK, a clinician has to use his or her hands, eyes and ears, no matter what kind of machine you get. You get for watch the picking, you get for touch them. So that you talk so for feel, for the organs, then the belly, it's a must for every clinician. So we do it, cancer or not, it's basic. So most say, picking kind belly big. The first word they do is, I don't tell me say the belly big. The next thing that we hand they put, for feel, what do we feel? Okay, so now mass will feel, or is it a big liver or a big spleen? We don't know. Or is this a mass coming from the kidney? Just with your hands, we will know. Now, the next step is for you for image that belly. So now, we tell Soyat people how they help we don't go beyond ultrasound. Now they do CT scans and MRI scans for them pick here at no cost to them. So partner with Choice Camps Hospital, then they give a discounted rate for do CT scans and MRI, which is what is done in the West. That gives you a very detailed picture of what is happening in that stomach. So those are the steps. So clinically first, we go for take history, we go for ask you question, how long you don't do, how we start. That's the first thing we do. Then we go for examine you, we go for look you and touch and listen. Okay? Then the next we go for investigations then. So they do blood tests, different blood tests, depending on what we think is wrong with you. Or they do imaging. So this imaging is very important. What to just foresee how much damage the cancer don't cause inside, but also they tell we how far it don't spread. Okay? Though they do pathology, when are the key to the diagnosis. So pathology is taking a bit of the mass. So the surgeon can help we take a bit of it. Can go to the pathologist, so they look at a lab, it tell you, so, okay, this na this type of cancer, this na this type of cancer, this na this type of cancer, and it's all available at no cost to the parent. So when they tell we say, for sure, this na a nephroblastoma, a certain type of maybe not nephro, because nephros we don't need biopsy for diagnosis, just the imaging typical. But let's say a lymphoma, I go tell you, so okay, this type of lymphoma from the biopsy, because every cancer again in treatment protocol, auto blanket, auto one size fits all.
Okay.
Yes. So that is how the diagnosis goes. So it's not just with a guess or with the looking on so you get cancer. No, they do everything according to the book. That's how we diagnose you, because it's a big diagnosis for pronounce. You can't just do it half-heartedly. You have to be sure you are dealing with a cancer. You have to be sure the type of cancer you deal with, because you need to sit down with the family and explain before you do anything. And so we operate in terms of diagnosis. And they talk about they talk about how for talk with the nurses them out there.
Yes. Sometimes so they can discover situation in them picking or condition. They need to get the right treatment. They buy the medicine, but the nurse them, according to allegation, or can give the picking and the right treatment even when they don't buy.
So with childhood cancer, there's only one treatment center for Nana Salona or Ladurin Cottage. So anybody who get cancer, that's what we do, and this one doesn't apply. Our nurses are well trained. This also medicine we possibly put in embargo now. People are afraid the medicine safe, in fact. So what nurse they prescribe for you? I'm always there. With a resident, with senior resident, with all the higher care doctors, we are always there. Now, they determine your treatment plan based on protocol. And the nurses, one thing anybody who don't go through that word go say is the nurses in the cancer ward are one of the best in terms of treating the children. In the peripheries, they don't treat cancer there. That is then smaller government hospital. The only thing where we do this early warning sign training for is may not delay patients unnecessarily. If we don't come to you, don't treat her for malaria this week. It come out next week back with the same fever, you don't treat her for malaria. The third week back, think beyond malaria. Not make again, they go buy other medicine. Send them, go on a specialist hospital more we diagnose them properly. That is all. But we need a send no cancer treatment. But we have to be trained. Our nurses are well trained. They've been trained since 2018. They've been going through training. So they are well trained in handling these medications and giving it. It's not everybody that